I'm Ashley.
And I'm Sadie. And yet again, we're Ashley short. Our schedules yeah, our schedules are just insane right now. But this will be a good one. We are still gonna touch on testosterone today. And obviously we're gonna have a part two that will be coming as well. And like we talked about before, this will not be the first, last, only time that we're gonna touch on hormones. We're pretty passionate about that, and with Duncan here, that's kind of her bread and butter. So we're gonna get into it. Yes. So today again, we're gonna talk about testosterone, what it is, why are people taking it? Is it only for men? Why are women taking it? And why?
And why is there this kickback or like this pushback?
Yes.
So yeah, lots of good things.
It's gonna be a little quick. We're gonna try and dive into some stuff, but definitely not going to be super in depth professor level. There's so much with it, and we just kind of want to give you guys a general overview for some of you that are curious and kind of what's going on in the world of testosterone right now.
Don't you think like we're hearing about it more? Like I would say even I feel like over the past year I'm noticing it more, but that could also be, when you get a yellow car and then you notice everyone else has a yellow car.
All the yellow cars?
Right. So it's like, is that part of it? But I do think part of it is we're just becoming more educated. And so as more women are finding out the benefits and that testosterone is not just a male hormone.
Yes.
Because truth be told, women make more testosterone than they do estrogen in their body. And I mean, I would have never known that, but it's 3 to 4 more times. So part of the testosterone that you make does get converted to estrogen by a process called aromatization. And, we don't have to get too scientific-y there.
Yeah.
But I think it's important for females and even the males to know that testosterone, it's not just the male hormone. It's not just the sex hormone and, get muscles, and men aren't just using testosterone for midlife crisis, and because I think that's another thing that I know personally. When I used to think of getting testosterone, it was kind of that age group, and
you think like your classic like 40-year-old dad bod, kind of something. I got to get something figured out. But it's definitely not the case anymore, and it's not the case where it's just for men. It's
right,
and it's coming out a lot that women, like you said, need it. That's our building block for everything else. So you don't have your base, you don't have anything else.
Right. And that's definitely what we desire to get into today. Just building the case that it's so much more for women than just libido. And we'll get into what is it, how do you know if you're low, or how do you know if testosterone replacement might be an option for you? And then how do you go about, because you're going to find, and we'll get into this too, that there are many providers that they're just not educated. I would like to say, or hope, that they're just not educated and not just being arrogant.
Right.
I would hope that to be the case, but I think you and I have both had stories from people, patients, friends, colleagues, ourselves, where I think some of it is just ignorance, and it's easy to just not deal with it.
Especially as a female, when you go into your general practitioner and say, hey, I think I might benefit from testosterone, the nurses look at you weird. Sometimes your doctor looks at you weird. Like, it's something I think a lot of women are afraid to even think about, because there's just such that stigma with it. Like, testosterone equals men,
right? Like
equals manly, equals a beard, a lower voice, Adam's apple, all those things, and then that's not the case. You might be low on testosterone, and that's why your estrogen and progesterone are all messed up, because again, you don't have that building block, right? Or you've got, you get into it a little bit, but it's like the mind fog, and you're just not yourself anymore, and you can tell something's wrong.
And that's what women will report when they do start feeling better, is they can't really put a pure specific example. They might just say, I don't know what's different. I just feel myself, or I just feel better. And you're like, well, how do you feel better? And they're like, I don't know.
I just
do. Yeah. It's hard to mark that because some of it is very subjective. Because it's hard to place, we'll take libido, for example. I mean, unless you had them fill out a questionnaire ahead of time, like on a 0 to 10 scale, like what's your desire? 3. What is your ability to orgasm? Like, where is that? How many times a month? But then how many times do you initiate? Like, in order to have a subjective outcome, you need subjective measures. And a lot of what we're talking about today, it's just really hard to
it's not like
objectify that.
Yeah, it's not so much quantitative data as it just quality. Like,
yes,
quality
100%.
of life and feelings are very hard to measure, and it makes it very hard to market or get it. Can't think of the right word, but as far as like someone saying I feel better in life or I want to have sex with my partner more often necessarily isn't going to equate into a research study that's going to get this approved for XYZ, you know, or hey, I can get my to-do list done. That's not something a research, company's going to be interested in. So it's just stuff like that.
And maybe one woman, her desire is to be more intimate, to desire more intimacy with her partner. But maybe another woman is like, you know what? I'm not with a partner. I don't really care. But I do care about remembering what I was going to get at the grocery store. And I do care about my bone health. And I care that I would like to still go to the gym and have great workouts and
feel like I'm actually making progress, even though I'm checking off all the other boxes.
Right. And so, and a good provider, whether it's traditional provider, at your PCP, for example, or if it's at a clinic, specialty clinic, whatever it is, a good provider is going to look at your symptoms and what you're reporting and not base everything off the labs. And that's
and not number chase.
Yes. Because what your number is, whether it's normal or not, out of the range, and my number, I could have the same exact number and we might feel completely different. Yeah. And so it's really not about the number that you're at. We can use that as a tool to help gauge, like, okay, do you need more or less, or, what's it doing? What's your dose contributing to that? But it's definitely more symptom driven than, what the number is, because it's so individualized.
Yeah. And I think we'll get into that a little bit when we kind of talk about like the reasons for why it's prescribed or when prescribed and all that type of stuff as far as the numbers go. But yeah, like you said, and it's frustrating because the normal range, so we'll just take males just because that's, for the most part, that's what a lot of all the studies are based off, are on men, and that's what's most common knowledge. But like the men, they're from 300 to what 1200. So sorry, we've got my kids are home, so
it's all right. It's all right, mom life
in the little pod lab, which is also her room. So, but anyway, so for men, their normals are anywhere from 300 to 1200, and that study was based on men from 18 to 85. So it's like that is such a wide gap, and yeah, you might be within normal, but if your normal was 900 and all of a sudden you're 330, you're probably going to feel like trash, but you're still considered normal.
Well, and then on the flip side of that, what if you have a male, just because that's what we're talking about for the time being right now, but like, what if you have a male that's 250? So you mean to tell me that male doesn't get the benefits of testosterone because he's like just shy of the quote normal lab? And so how, it's like we're going to talk more about women today, but like, I think that's a good example of, males get shorted too, where they could benefit from this also. But, if your provider is solely just going off of this range and not looking at the individual, you could, everyone's not getting the benefit from it.
Yeah.
So let's, as far as like, we kind of touched on like what testosterone is. But it's really one of the most vital hormones for men and women. And like we said earlier, it goes on, it's so much more than just the libido and the muscle and whatever else you've heard, whether it's providers, whether it's other family members or friends or social media. But, females need testosterone. And, we know that obviously we produce estrogen as females also, but like I mentioned earlier, testosterone is actually a precursor to estrogen. And so through that aromatization, we need that conversion of testosterone into estrogen. So really what that means is that if you have a low testosterone level, that can also result in lower estrogen, which can also worsen your symptoms, especially during perimenopause and menopause, which that's a whole nother podcast. But really, I mean, what we're going to get into is that if you support the testosterone, this really can help overall balance estrogen also. And then let's get into, some just like key reasons. Like, we've talked about like what it is. Yes, we make 3 to 4 times testosterone than estrogen, which to me is mind blowing because I never knew that.
Yeah.
I think too, like it's measured in different units. And so when you see it on paper what the normal range is, and then you see the normal range of estrogen, it can be misleading because you're like, no, we don't, our normal levels are, less than 100. So anyway, so I thought that was interesting to me when I was first, learning about testosterone and really getting to it. So I think the main obvious use for testosterone for females specifically, sexual health, obviously,
would be
libido,
which, and we'll kind of get into that a little bit too. But like, as far as getting it, I'm jumping ahead a little bit, but it's just my squirrel brain. This is how it works. But it's frustrating that as a female, one of the only reasons I can essentially have a better quality of life and have some of my hormones fixed is because I have to want to have sex with another human, like
right, and
that, which is, I mean, obviously that's nice, I'm sure my husband appreciates it,
right, but it's a nice benefit,
but it's frustrating. Like, that should not be. Why is that the only thing that matters for me as a female in order to get testosterone,
right,
when it's so much more effective? And we'll get into all the other things that it affects. That's essentially way more important. Not that sex industry isn't, but like you said, if you're a single female or you're with a partner that's not an issue, you might not know that you still need and could benefit it from it.
Right.
So
well, and I don't think we've said this yet, but there is no FDA use, so approved use for females in the U.S. Now there is in Australia. That must be nice. But in the U.S. right now, there is no approved FDA reason. So when females are getting prescribed in a traditional setting, it is for actually the off-label use of low libido. Like that's that's the off-label use. And you and I have discussed before, that's frustrating because most insurance companies won't cover sexual health.
Yeah.
So testosterone, you can still get it, but you're probably going to have to pay out of pocket for it.
Yeah, or go to a clinic or something like that where it is, I'm sorry, but it's really expensive.
Mm-hmm.
It can be
in
really
different
expensive.
Forms, yeah.
Yeah.
So there are different forms. We'll talk about that, but yeah, just that sexual health, that's a big one because men get their sexual health needs taken care of and paid for insurance, and it is so common to ask a man, well, how are your erections? How's your ability to orgasm? Like that's such an open conversation, I feel like, anymore. And maybe not. There are some people who are more shy to talk about that, but I think it's way more uncommon for females to walk into their provider's office and start talking about their low desire.
How many times has your provider, and this isn't fair because I mean your husband's provider, so, but how many times has a provider actually, as a woman, looked into you and be like, how are your orgasms? Are you having orgasms? Like, as a female, that's just not. It's just not thought of.
Right.
And granted. Okay, that's a whole other topic because there's so much that goes into a female being even able to do that. But still, it matters.
It matters. And how I hear this all the time, or I feel like sexual health will have to like talk in, like you said, a whole nother podcast. But I think as females, we've almost got to the point where there is some females that they actually just truly don't desire it, and maybe part of it is their to-do list, and part of it maybe is they don't feel desired, or all the different reasons. But it's kind of a joke. I've heard women joke about it. So when you're asking me about, does your provider ask you about your intimacy, your ability to have orgasms, I think it's more of a, oh my gosh, if I could just get by with it's joked about as truly being a chore. And that's just kind of sad for me because I feel like women should if that's what their desire is, they should be able to enjoy it. And
yes.
So testosterone can definitely do that.
Yeah.
It also increases blood flow,
which
to
makes
the vagina, which
a little better.
yes, like more
when
sensation.
It does happen. Yeah.
You can have better orgasms, better
Yeah.
quality of orgasms, increased frequency. Like some women have difficulty orgasming in the first place. Now maybe it's their lack of their partner's ability.
Yeah, there's a lot that goes into
There's
it.
a lot that goes into that, but just in a general sense,
Yeah.
that testosterone can really help.
Yeah.
We'll talk about side effects later, but one of the side effects that can potentially happen is a little bit of enlargement of the clitoris. Not very common, and that's so subjective between each.
And we're not saying like you're gonna grow like a little baby peen. That's not.
Yes.
That's not
But
even. Yeah.
if there is even any type of growth, that's not necessarily a really bad thing, because some women naturally have a smaller clitoris, which can impede their ability
sensation
to have,
and all that stuff. Yeah. So, like we talked before, if anything, it's just more surface area for play and for pleasure.
If that's what you want.
Yeah, which isn't necessarily a bad thing. Like we said, it's by no means going to make you have like I said, like a baby peen, but a little bit, or a little bit more of it exposed, I guess would be another way to phrase it. Yeah.
So let me ask you this, or this kind of circles. I mean, as females, I feel like we have to be in the mood to even want to have sex. Like, I feel like there's, responsive desire, and, where it's like, if you talk me into it, or, do some spicy things, like I can respond and become desire.
Yeah.
Or responsive.
Yeah.
Gosh, getting all flushed here. But then the other type of desire is the type where it just comes out of nowhere. It's
think your classic like teenage boy sitting in math class with a boner.
Yes. So as females, we just don't get that type of desire as frequently.
And that doesn't mean there's anything wrong. That's just one of the differences between male and female.
Right. So if you have a hard time like getting into the mood, or maybe, you're in a bad mental health space, or maybe have some depression, testosterone can help that, because testosterone does work on your brain in regards to your mood and overall mental health. So, if you think of it, and we've heard this marked by other, podcasters and physicians, but, it's kind of like thinking of testosterone, libido is a mood, and mood comes from your brain. So if we improve your brain health, naturally that should make your mood a little bit more persuasive.
Yeah.
And, if you're dealing with depression, or just having low energy, and you're fatigued, and just little motivation, you just don't feel like anything. You just
want to get your to-do list.
You don't want to have sex either.
Yeah.
So if you can fix that, if testosterone will help you fix that, that's where it can become beneficial, as far as like, that your mood, your mental health, but also for like the whole, sticking with the brain, just that overall like sharpness, mental clarity.
Yes.
You kind of feel like this
memory.
This fog is just lifted, and oh my gosh, I can remember what I was going to get at the grocery store, and I can remember where I put my keys, and
and able to like focus on more than one thing. You think like your brain's got how many different tabs open, just like a computer browser, and you get to the point sometimes where, man, it's too much, and I can't sort through the tabs, and they're so small, and I can't find the one I want. And now all of a sudden your brain is working better. It's working the way it's supposed to. It's working the way it did 5, 10, 15, 20 years ago. And all of a sudden you're like, oh, I can have multiple tabs open and successfully
and I'm getting shit done.
Yeah, handle them and be able to shuffle between them, and it not be like the end of the world meltdown, just it's too much, I can't do it, and I'm just gonna sit here instead. And
even that memory, like you said, just your ability to focus it can be greatly improved. And with that being said, when we were talking about just your mental health and kind of like the state of lost my thought there for a minute, so how many women, I'm sure that you and I can both think of women, but there are multiple studies to support too that there are huge numbers of women that are on SSRI. So those are antidepressive a medication class that are, usually first line therapy for depression or anxiety, decreased mood, into perimenopause and getting into menopause, and even like our age and people with low testosterone, like, some of those symptoms are the brain fog, and you just can't remember anything, and you have focus, and some depressed like symptoms, and you just lose that drive, or maybe all of a sudden now you're anxious about everything, or now you're worried about everything. Where did that come from? And providers are very quick to just slap everybody with an SSRI. Well, then SSRIs, one of the side effects is decreased libido.
So
it's like this snowball.
It's just this vicious circle, and it's frustrating because it's like, okay, maybe I wish, this is gonna be me on a tangent, I get very frustrated with like the American health system, because a lot of times I feel like we, like you said, we band-aid something, we're like, hey, take a pill,
Prozac for you, and Prozac for you, and Lexapro for you, and Paxil for you,
and don't be wrong, there are absolutely people that need it and that do benefit from these things. Like, I'm not trying to say like no one needs this stuff, whatever. Yes, there are people that do benefit, but like you were saying, how often are we so quick to just jump to, hey, take a pill, where it's like, maybe if we stopped, we did a full actual hormone panel, not just your basic one that like your general provider usually does, that checks like your HCl, your thyroid, that type of stuff. It's like, no, let's do a deep dive on your actual hormone levels and see, because like you said, maybe it's just you have low testosterone, because
or other things,
and
deep with your hormones.
And I would say the majority of women, regardless of age, just because of the way just society and life is today, we're all low. I think that the majority of women could really benefit from taking some form of testosterone, because like you said, it's that building block, and without that building block, nothing else can work. So if your foundation's crumbling, your house is going to start to sink.
Well, and then you start pairing that with our crap diet. No one wants to move and exercise. No wonder we're all depressed. We're like walking around with low T levels and all these horrible lifestyle habits, and then we wonder why we just don't feel good.
It's for like men and women. Like one of the things I just saw is like sleep. Like one bad night, again, is for men. And I'm sure.
Do we study women at all? Like, do we even exist?
And I'm sure it's probably similar for women as well. But it was like one bad night's sleep of like a sleep shortage. I think it was like under 6 hours, or 5 or 6 hours for men. Is like almost a 20% decrease in testosterone the next day. That's wild. So now you take that and you compound it. Well, it's no wonder a 22-year-old male who should be like prime test, is sitting in the 200s, 300s. Well, yeah, because he's sleeping 4 hours a night. He's slamming beer. He's not working out. He's eating McDonald's every day. That's filled with, oh my God, level hormones that are not good for him in general, And we're not taking into effect all of these things, the whole picture, and how much, like you said, even just a bad night of sleep can affect your hormones the next day.
There was another kind of similar, to piggyback off that a night of sleep would decrease the percentage of your protein utilization by your muscles. So if you have this great workout and you've been doing really good in all the things like eating and exercising and lifting heavy stuff.
You're checking all the boxes.
But then you don't get your sleep. Your body can't recover appropriately, and therefore you're not going to build more muscles. Like, your body has to rest, restore in order to rejuvenate.
It's almost like you're not charging your phone fully. Yeah, you're plugging it in for a little bit.
Yeah, that's a great analogy.
But you're not letting it charge to 100%, so you wonder why it dies halfway through the next day. Well, because I didn't let it get to 100, I let it to get to like 63.
Even though you keep it in the case and you're very careful,
you got the warranty on it.
Right. It doesn't matter if you're not charging it. It's not gonna, great analogy. Okay, so then that kind of circles into, bringing the muscle mass, where testosterone can really help to build and maintain the, lean muscle mass. So think of your toned muscles.
Yeah. And you're not going to look like Arnold Schwarzenegger or whatever. Just
maybe.
Yeah, geez. It's not. Everyone thinks, I'm going to take testosterone. I'm going to blow up. I'm going to look like a man. Okay. First of all, no. Building muscle, like we talked about, is super hard, regardless of whatever extra stuff you're taking. But if you just are taking it and you're not doing anything else, you're not lifting, you're not working out, you're not doing healthy, it's not going to do what it's supposed to do. Just
Right.
like anything. So yeah, if you take and you work out, you might notice a little bit like improved recovery, or maybe my muscles are responding.
You're getting stronger. You're lifting
Yes,
heavier.
I'm
Yeah.
making progress like I would have if I was 16 to 24 compared to 40 to 50.
Right.
Things are harder, but if you give your body again those building blocks,
The tools.
that's a nice, quote off-label benefit of it. Like all of a sudden
Right.
things just
I
look
mean,
and feel better.
At that point, you're just optimizing what you're really working hard at doing,
Yeah.
and you're allowing your muscles to work at optimal capacity. And it's also going to have an effect on your metabolism. So now your body is, all the engine, everything's churning.
Yeah.
And so that's how people are able to drop some body fat on top of that, because not only are they building muscle's more expensive for your body to maintain, therefore your metabolism goes up, you drop some body fat. That's a nice byproduct. But
yeah. Plus, again, you just have the energy to go to
work
the
on the
gym,
first
like to
place,
go
right.
to the gym or work out or walk or whatever.
Because it works on your brain, now you have that drive and the motivation to get up in the first place. Like everything is literally working together.
Yeah.
On top of that, now we have, studies to show that it supports bone health. So, think of aging women, they're getting older. Maybe they're not strength training, so they're already at risk for osteoporosis. Their bones are getting weaker. And then on top of that, they're not working out. So testosterone can allow them to, feel better, start working out. It's going to improve their bone density, prevent maybe some of these falls. And working in the medical field, we see broken hips, and
that's almost a life ender anymore.
I was just
like
say
that's
that.
just man.
It's like it's not joking, but we kind of say like that's probably going to be the end of her if she breaks a hip, because there's just data to support that. And so being able to work synergistically, with estrogen, it does help to maintain strong bones, and you lose estrogen also as you get older. So that's why these women, they're at higher risk for osteoporosis, osteopenia, softening bones, and just that overall, the energy, the vitality that we just kind of lose sometimes when we get older. We're busy, our bodies. And how many times have you heard someone joke, whether it's you or, maybe your parents, but you say a complaint like, gosh, I'm just not sleeping at night. I'm just, my joints hurt. I just can't remember where I put my keys. Welcome to your 40s.
Yeah.
Like everybody just wants to say, that's
just part
happens.
of it.
So like what happens? We turn 40 and we just turn to shit?
Yeah.
Like it doesn't have to be that way.
Yeah. And it's, and it's frustrating. And one thing I found is I live a relatively healthy life. Yeah, I've got stress. I don't sleep the best sometimes, prime example, my feral children are pounding on the door outside the room, but it's like,
it makes you relatable.
Yeah. I was getting so frustrated because it's like, man, I am checking off all of the boxes. I'm doing what I need to do. I live a relatively healthy lifestyle. I'm not out here slinging McDonald's or all this other stuff, but I'm like, I just don't feel like me anymore. Like we said, like the brain fog and stuff like that. And it gets so frustrating to start feeling like that. And then no one's listening. And I didn't even know that this was even an option that might be a problem. Like I had never even, it wasn't even anywhere close to being on my radar. Like, oh, hey, maybe I might benefit from that. And just circling back to, again, because hi, hello, squirrel brain, we keep talking about like the off-label stuff. And I know everyone gets like freaked out about, oh, that's an off-label side effect. That's off-label. That's not necessarily bad. Like there's a lot of medications and stuff in general that is used for like the quote off-label benefits.
Off-label, right.
Like we were talking like birth control which that's a whole other topic and podcast. I won't rant about that, but as far as like the birth control, think about all the quote off-label reasons that could be prescribed as far as like acne, mood, stuff like that. When that's not necessarily its
heavy period.
Yeah,
and it's meant to prevent babies,
pregnancy. But an off-label quote benefit or side effect is the acne or like the the mood and stuff like that.
Well,
So
spironolactone, that is a potassium-sparing diuretic, but because of some of the hormone benefits, you hear many women and males too, but um, my encounter is mostly women who use it because of acne.
yeah,
So, if we'll get into side effects here, but if a woman female is having some issues with acne, whether it was caused by testosterone or not, just in general.
yeah,
So that's an off-label use. We use off-label uses in medications all the time.
all the
We
time.
we talked about Ozempic
Yeah,
and
that's a
semaglutide.
perfect example.
It's
Yeah,
off-label. It was meant for
insulin.
diabetes
Yeah,
and insulin sensitivity in that.
yep.
There are on-label uses
Yeah,
for your semaglutides for weight loss, but
yeah.
traditionally, like we said in those other episodes, I guess our point that Sadie's trying to make is yeah, we use off-label
It doesn't make it
medications
scary.
all the time,
Yeah,
but
and
we've made it scary.
yes.
And that brings us to, so testosterone actually had kind of this black box warning for a long time, because back in 2014 there was concerns about increased incidences of cardiovascular risk, and like think heart attack, strokes, etc.
A little bit of cancer and stuff like that.
And so they were using that, they were associating that with testosterone when it was used for age-related low levels without having an actual medical cause. So pretty much a lot of the males that take it right now, that would be considered, those people were considered at risk for cardiovascular disease. But the good news is, as of February, the FDA, they removed that box warning.
And that was based off of literally one study. And I think, Duncan's going to get into it a little bit, not to interrupt her, but it's like when you deep dive into that study, you're like, oh, that wasn't actually what was happening.
Right. So the Traverse study was the study then that showed that, no, these men aren't necessarily at increased risk. Now, they kind of left it out there to say, you might still have a chance for increased blood pressure. But my rebuttal to that is, hey, if you're going to get male or female, if being on testosterone is going to get them to start having the drive to work out, start going to the gym, now they're building muscle, now they're losing maybe some body fat from the increased metabolism, they feel better, that would give them lower blood pressure. But I know that it goes much more beyond it than that. So, I mean, that is the good news. With that Traverse trial, really, it takes some of that scariness out of testosterone. And, you and I have talked, men take 10 times, their normal range is 10 times, or excuse me, what they take in testosterone doses is 10 times what a female would take.
Yeah.
And based on your beliefs or whatever, we are not giving an opinion, but how many transgender females are taking testosterone 10 times the limit of what another female would take, so that they're matching males, and they're doing just fine. So,
and we're not talking about just recently either. Like, that is, yes, it's more prevalent now and more kind of, quote, public and in our face or whatever. But that's been going on for long time. It's not like, hey, well, we don't know what's going to happen in 10, 15 years.
Right.
We do. They're not getting getting cancer from this. That's not what's happening.
Yeah. So, let's get into, so how do I know if I'm low? We've kind of like talked about what it's good for. And so you're kind of gathering how to know you're low. But let's get into, just how do I know? Without necessarily getting tested, what might prompt me to come into, whether it's your own provider, and we'll talk about how to do that later here in a second. But, first of all, if you have low libido and you're just the type of woman that you're just like, I never want sex. I don't desire it. I don't care. I could go weeks. I could go months.
In regards to, and you think, like we said before, take in consideration, you're not, constantly having a sink full of dishes. You're not stressed to max. You're not in debt. Life is good. Again, all the boxes have been checked. Your husband, wife, girlfriend, boyfriend, whatever, is an absolute smoke show. Like, they're making the effort. There's no outside.
Right, I see what you're saying.
There's no extra reasons. And yes, libido is a roller coaster. It is up and down. You're not going to be a freaking horn dog, 16-year-old, 24/7. Like that is unrealistic. But
I
when
think you
should
have to sit
be,
down
yeah,
and ask yourself, like, okay, why don't I want it? Like, and circling back to what you're saying,
yeah,
is it because you're too busy? Can you just not get in the mood? Are there
yeah,
relationship problems? Testosterone will not fix a shitty marriage.
right.
This
For
has
guys or
been,
girls, like,
and the type of sex you're having. Like, is
mm-hmm.
the type of sex you're having worth desiring?
Yeah,
So if it's just, not that great, like, you're not going to want something that's just,
yeah,
not very, not saying it has to be exciting and novel and all the time,
yeah,
but, think about, like, when you are looking forward to a favorite meal or your favorite
yeah,
movie, there's
yeah,
something that brings you back to it. That's the
mm-hmm.
reason you keep going back to the same restaurant. So if you're just not into the intimacy with your partner, you're probably not going to desire it. So,
Or even just by yourself. Like if you're having
right,
if you're
right.
struggling just by yourself,
Mm-hmm.
that's probably a pretty good sign too. Like I should, like, for the most part, you should know
Yeah,
what's gonna trip your own trigger
right.
by yourself. Everything's right. Like you're not worried about, you're not in your head or whatever. Especially for guys, like if you're struggling to maintain an erection, like, and
And
it's
some
just
will
not
even say,
happening.
like, if you are losing, like, your morning erections, or
Yeah.
maybe your morning erections just aren't quite as strong as what they used to be, or maybe
Mm-hmm.
there is some erectile dysfunction where,
Yeah.
maybe they're really ready to go, but just the equipment's not working. And,
Mm-hmm.
that can happen as men age. That percentage goes up and up and up.
Yeah.
After 50, it's like 50%, and it goes up with your decade,
Yeah.
for percentage. So that could happen, but testosterone can help that.
It
And
doesn't have to happen.
right, right.
Yeah.
Or you can lessen the blow,
Yeah.
so to speak.
Oh
Did you like
no! Or
that?
would that,
Although
that
actually,
increase the
you'd
blow?
be increasing it. Yes. But okay, so sex drive, we've already kind of said, if you have no energy, the
Mm-hmm.
brain fog, maybe you'd love to go to the gym, but you just can't bring yourself to get off the couch. Muscle weakness, maybe this body fat that it doesn't matter how long you've dieted, it just seems to hold on.
Yeah.
Mood swings, we said that, like
Yeah.
depression, just kind of like sad, anxious,
Mm-hmm.
irritable,
Mm-hmm.
sometimes that can really be prevalent as women start going through some perimenopause. They're
Mm-hmm.
just like, what is wrong with me? Like, I'm so pissed off at everybody.
You feel
I'm upset, I'm
yeah,
anxious,
you literally feel
like
crazy.
a little crazy.
Yeah,
Right.
it's almost like, not to like generalize, but almost like like the week before the week of your period, where you're just like, what is wrong with
Yeah.
me?
And
Like I am all over the
right.
place. Nothing feels stable. I'm crying at like an ice cream commercial.
Or I'm freaking out.
Yeah, or
And isn't it
mad, or
crazy?
ugh.
Because sometimes you don't even recognize it in the moment until you take a retrospective look at it and you're like, oh my gosh, that was
Yeah.
not me.
Or
And
you get your period and you're like, oh.
right. So how many of these women are walking around being told that they're crazy, or
Yeah.
even feeling a little unstable?
Yes.
And then it's not until they start some testosterone and they can look in the rearview mirror and be like, oh my gosh, that's
Yeah.
what was wrong. And so that's what we mean by saying sometimes women will report that they can't even tell you what happened. They just feel better.
I just feel like
me again.
Yes.
Mm-hmm.
So I mean, and kind of speaking for like from personal experience and stuff, and I kind of wanted to touch on this earlier, and then we got going with the other
Mm-hmm.
stuff. But one thing too, I get super frustrated, and even as someone who is taking it, and I find like I'm I'm trying to think of like the right word to use, because I don't want to say ashamed, 'cause that's definitely not it. But I'm almost like hesitant to tell people, oh yeah, like I take testosterone, because it comes with such a negative stigma as
Mm-hmm.
as a woman taking it. Like you get weird looks, or people like, oh my god, or whatever. It's
Like,
like,
why?
yeah, like why?
That's weird.
Yeah, or like, oh, it's because you do bodybuilding and that's why. And it's like,
Mm-hmm.
I'm not even taking anywhere close to the dose that it would even make a difference for the quote bodybuilding side of
Mm-hmm.
it. But it does suck. It's like, you're scared as a woman. You're scared to even one talk about it, ask about it, look into it,
Mm-hmm.
because you don't want to get the side eyes. You don't want to get like the weird reactions, like, oh my gosh,
Right.
or people think that, oh, I'm taking testosterone, so I'm taking steroids.
Yes.
That's not necessarily,
And
that's not
they're
the case.
so
Like I
different.
just, yes, like so for me, kind of look at the signs and symptoms. I was having a lot of that where I was just like, man, I cannot remember anything like at all. Like I'd literally be in the middle of a task and like actively be forgetting, and I'm like, what was I doing? Like I came in, like that classic, I came into this room for something. What, I have no idea.
Mm-hmm.
Um, that, and then like and the mood swings and the irritability, which, and I know a lot of that for me, like sleep, my work, stuff like that. I know that plays into it, but I'm like, man, like I am just something's
like
off.
something's
Like
wrong.
I'm not good, that super low level. Like I can pound all the caffeine, coffee, energy drinks, pre-workout, and I'm just like, I just feel like a bag of dicks. A bag of sad dicks. Like,
well, and in my case, I mean, it's a little awkward to say, yes, but like I just was never one to really care about intimacy. Like it was like, I can take it or leave it. Like I was probably one of those women that was like joking about like, oh my gosh, if I could get by with never doing that again.
Yeah.
And I think that just kind of lifts this cloud of like, oh, it's all right. Like it's, I might be interested in this.
And then when you start like actually being intimate with your partner again, you're like, oh, this is like,
right,
this is what it's supposed
connection.
to be
right.
like, and this is supposed to feel like, and all of a sudden, like, you're having like way better orgasms, or you're actually able to even in general have one.
Right.
Yeah, which, and that's huge for a lot of people. Like, like you said kind of a little bit before earlier, it's like most women just don't even think about, when I have sex, I'm if I orgasm once every year,
right. I'm doing my wifely duty by doing this for my husband, and I'm kind of forgotten about, but I don't really care. So
yeah, it was like we expect guys, obviously, to get off every single time they have sex, or masturbate or whatever. That's just like, that's normal. Guy, that's what happens when a guy does it, and it's frustrating because it's like, okay, well, but what about women? Like, why are we also not thought about in that regards too? Like, why,
like sexual beings?
Yes, like why is it, not to sound crude, but why isn't me getting off just as important as you?
Right. And maybe, maybe it's okay for the woman to be able to finish, and maybe the husband doesn't have to finish.
Yeah, that happens like, sometimes, like that's fine. It's not.
It's just right. And I think that the key point is you've got to find that balance with your partner.
Yes.
And what works for both of you. But it's really not fair to your partner, the person that you made this lifelong commitment with, if they still have an interest in sex and being intimate, that you just decide, well, I just don't want to.
And you don't want to fix it or find out what's going on.
Because that's not fair to your partner.
Yeah.
And so I think you just really have to find that balance, that maybe it's not as much as what they want, but it's still more than what you wanted. So finding that that balance there.
Yeah. Because I know like when I started, like libido and stuff wasn't necessarily a big issue like on our end. But for me, it was just everything else as far as like the quality of life stuff. And I finally felt like when I did find a provider, one that actually would sit down and listen to me and like didn't dismiss me, and would actually ran a full legitimate panel and was like, oh yeah, like you're like, wow, low, like, yeah, we're not chasing numbers. And I don't, we're not going to put numbers up because then that's what people are going to look at and chase and stuff. But it was like, now I'm at almost 5 times my levels as what I was when I started 8 months ago. And I literally feel like a different person. Like my marriage is better, my quality of life is better, my job performance is better, my gym performance is better. Like just in general, like you said, it's hard to put an actual like quantitative result on it other than like, I feel like I'm supposed to feel, and I'm not growing a mustache, like I'm not growing an Adam's apple, like none of these bad things.
Don't let the side effects. So there are a couple potential side effects. Some increased facial hair. Unless your level is skyrocket high, you're not going to get crazy facial hair. Maybe a couple extra little guys that you need to either shave, wax, laser, whatever you're fancy. Your Adam's apple is not going to grow. You'd have to be on such high levels for a long time.
Yeah, you're not going to start growing like a dad bod balding spot,
Yes. Your voice will stay the same again, unless you're not having a provider that's not only listening to your symptoms but managing and asking like, how do you feel? Are you having these? I mentioned like an enlarged clitoris could be a potential side effect. I would say, if anything, what I see as a more common side effect is maybe a little bit thinning around the hairline. And again, not even a lot. And typically if someone has that as an issue, we'll put them on like some spironolactone, and
that can play a lot of genetics too, like you just are genetically prone to that.
That's a great point, because as you age, there is a percentage of women and males that they're going to lose their hair regardless. So, it's hard to say like, okay, I got put on testosterone, now my hair's thinning. Maybe that was going to happen in the first place, but now since you're on testosterone, it's just easier to blame that. So, the key thing is like working with a provider and, managing, like we said before, your provider, if they're a good provider, they're going to be managing your symptoms individually as a unique patient and not just going off labs. And so finding a provider can be difficult because they're not providers like your general docs, medical doctors, your DOs. They are not given a lot of training on hormones. And so, we can't hardly be upset at them, because who wants to put their medical license on the line and be giving advice and prescriptions when they don't feel 100% confident in what they're doing?
Right.
But you've got to find a provider that's on board, have your questions ready, have your information, have your concerns. And, there are other specialty clinics that's what they specialize in. However, you're probably going to pay more because insurance is not going to cover that. Whereas at least if you're finding a provider in the medical setting, insurance
higher chance for getting insurance, especially
or at least
as a woman.
some of it covered. Maybe some of your labs will be covered, some won't. But so you really have to look at financially, what are you able to do, your location, the convenience, all the things like when you're choosing a provider in the first place.
And don't give up. So kind of a sidebar, but like on topic sidebar, a personal story. And I'm not like going to mention names or who or whatever, but I did have a friend who he was having really, really bad symptoms. Like the classic, like had really bad ED, wasn't interested, like brain fog, super moody, super irritable, like depression, like literally like you check all the boxes for like your testosterone is not okay for what you're supposed to be. He was checking every single box, and this is supposed to be a middle-aged, very fit. Well, he was younger at the time, probably 20s, like very active, very fit male who's like feels like he's 80 years old, and he went to multiple providers and they just dismissed him completely, like ran him out the door. There's nothing wrong.
You're too young, or your levels in normal range.
He was right around that 300 range. And so like, nope, you're within normal, there's nothing wrong. It's probably, XYZ, and out the door he went. And he was to the point where he was just like, I don't want to live like this anymore. Like, literally, he said, he goes, there would be days I'd wake up and I'd just be like, I can't do this today. Like, literally can't do it. It's destroying my relationships. It's destroying my job. Like, I literally cannot function as a human. And I'm looking at 60, 70 more years of this. There's no freaking way. And so he kept at it. He kept going until he finally ended up just going to a clinic because he did his own research. And he's like, holy shit, like, no, like, I know this is what I have. Like, I know that this is an issue. Now I just need to find someone that's going to listen to me and is going to like make that effort to help make it better. And he did, and he finally is now, totally functioning, happy, fine, doesn't have any of those issues. You think about, like we talked, how many times had he not done his own research and made the effort to go in? Like, he would have just
advocate for himself.
Yes, he could have just been put on an antidepressant, and which would have made it worse, and he might not be here today. So it's very frustrating to hear stuff like that. Like you said, it's not necessarily the provider's fault, because that's not something their specialty or they're educated in, but I definitely think it needs to be more talked about and more of a topic, because again, you have women in that same boat and they're not even knowing that testosterone should even be on the radar for them. Whereas he was a male, so he kind of had an idea, like, maybe I think this is what's going on. Whereas a female have all those same things, and it's like, I have no idea. Like, I don't know. I don't know. And I'm going to doctor after doctor after doctor, and they're telling me I'm fine. They're not listening. I'm being chased out. I'm crazy, whatever. Or that's just, you're at that age. That's just part of it. Like you said, it doesn't have to be. Like, it doesn't have to be. You shouldn't be like, don't have to be like ashamed or scared or nervous to reach out and start taking the steps to get put on it. And once you're put on it, like, it's a prescription, like, it's regulated, it's through a doctor, like, you're not taking like black market steroids behind the door. Yeah, you're not going to get fired from your job. You're not going to fail a drug test. You know, all these crazy things that people are scared of because, like, oh, I'm taking testosterone.
I think women don't realize, too, and even men for that matter, is there's different routes that you can take it. So I think right now, people hear kind of the pellet craze. You know, so a pellet, it gets put into the subcutaneous tissue. It gives you extended release of the testosterone for over about 3 months. Some of the drawbacks on, you know, just real quick, if you've never been put on testosterone therapy, you don't know how your body's going to react, just like any other medication. So one of the drawbacks to a pellet is once you insert it, you can't take it out. And so your level may skyrocket really high, higher than you wanted it to. You may get some side effects, or that dose may not be enough to give you relief of your symptoms, but now you're committed to having to wait the 3 months to get it inserted. Or other women, sometimes their level might shoot way up and they feel like this is great, but it doesn't last the entire 3 months, and then it plummets. Now they feel like crap, but it's too soon to get a new one. So I think there's a time and a place for pellets. I think the appropriate, in my opinion, and just off of research and my own learning, is I think an appropriate use for a pellet is maybe, yes, you can go in and get your pellet. I don't want to say like appropriate, but an option would be maybe try different routes of testosterone, find out kind of what your happy level is. Find out how your body uses it, how long it lasts, that sort of thing. And then you can try to match kind of what your happy level is with a pellet, you know, after you've used other routes. But I mean, there's creams, there's gels, there's drawbacks to those. They're usually a daily application. Some women just don't like dealing with the gel and the cream, you know, can be kind of messy, but it absorbs. And
one of the things again, I'm so bad at interrupting, so sorry guys. With that, one of the things too that I kind of learned and kind of helped sway my decision on what route I was going to use is like with the gels and creams, a consideration I took, and I didn't even think about it until I, you know, listening to a different podcast provider that was talking about it. With that, like if you have like littles or kids or stuff like that, just being mindful on when and where you're applying that, because there is the potential that it could rub off or it could leave a residue somewhere.
It could. I mean, typically,
not the end of the world, but
typically where you're putting it. But you're right. I mean, it could be an issue. So there's that. There's other, you know, some people, they will just absorb medication through the skin different. So maybe I have thinner skin than you do, and so what dose of cream affects me might be different for you. So
or hot, cold, how open your pores.
So with the creams, the gels, it might take you a little longer to find, you know, where that hot spot for you is, or happy place. I'll just keep calling it that. It might take longer. So, you know, that's one of the drawbacks. You know, like I said, it can be kind of messy. You can do like a sublingual tab. They call those like troches. I've heard it pronounced in all different ways. But it essentially, I mean, you put it kind of, you know, in your cheek, kind of under your tongue, and it just dissolves. The drawback to that is it can take a long time to dissolve. Some don't like the taste. Obviously, once you put it in your mouth, now you can't eat or drink anything for that amount of time. And then again, it's just going to take longer for, I think, you to see your levels go up to an optimal level.
Just a quick question with that, just because I'm like level 1 educated testosterone, and you're like way above higher. With that, a concern that like I think maybe people would have is like, so with the sublingual and like an oral, do you feel like there's a slightly higher chance for maybe some more of like the like organ toxicity, like as far as like liver, kidney, stuff like that? No, because
if you're doing it correctly, it's not going through first pass, like through the liver, because you're not digesting it. Because if you have it sitting in the subbuccal or sublingual, so under the tongue or in your cheek, it's getting absorbed directly into the bloodstream through your mucosa. So you're not actually swallowing it for it to go through the digestive system.
Okay, that makes sense.
So that's the difference. So there is actually like an oral testosterone now. It's super expensive. I kind of wonder if that won't become a different, you know, more popular
option.
But I think because of that first pass through the digestive process, through metabolism, what you take obviously isn't what you're going to absorb. And so when you take it orally, there's just an even more greater variance of how much do you absorb versus how much do I absorb.
Yeah.
And and then the last is injection, which injections, some will do 3 injections a week, some will do 2. There's different kinds of testosterone now where it's once a week, there's a once a day, there's a lot.
Yeah.
But I would say traditionally, what you see most men doing right now, and the women who do injections, probably more this route where it's like twice a week injection.
Yeah.
It's sub-Q, so it's no different than the needle that they're using for your GLPs.
Yeah.
Think of like a insulin needle, super small. And the benefit to that is it's only twice a week. If you wanted to do a smaller dose, but 3 times a week, men can get away with that a little bit easier because their dose is higher than women. But for women, because we're already using such a small amount,
it's like a little spritz.
It's so small. And so imagine making that even smaller to go into 3 times a week versus 2.
Yeah, I don't even.
So there's some thought that if you do it more frequently during the week, you get you get less highs and lows.
Yeah, less of that roller coaster up and down. It kind of keeps that like a nice level, even.
For women, that's not so much the case because we're already riding such a low number.
Yeah.
But for men, their levels can get higher up there. And so if they're taking these bigger doses twice a week, they would have bigger peaks and valleys than what we would. So some men will choose to go 3 times a week. But so I guess the point is there's just different routes, and maybe that's some of the drawback to females is they hear of like injection. I'm not giving myself an injection.
Yeah, and literally, like you said, everyone thinks it goes right to like black market, like
that's
behind
illegal.
the dumpster, like steroid back gym locker use.
Yes.
And it's not that, like, you wouldn't throw shade on someone doing that for
diabetes,
like their diabetes, stuff like that, and it's the same. It's like you said, the same syringe, like just a different medication. Prescribed medication, like.
So, and we don't have to get like completely into labs, but making sure that when you're seeing your provider, they're doing a full panel. Obviously, so you want to get a total testosterone, but then it's important to get a free testosterone. So testosterone sometimes will bind to other proteins in the body. So whether it's protein or SHBG, which is sex hormone binding globulin. So that's just a larger protein that binds to the sex hormones, and testosterone is one of those. So you may have like a higher total testosterone, but if part of that is now binding to protein and part of that's binding to your sex hormone, then there's less free testosterone to actually be used. So if you hear your provider say, well, let's grab a total testosterone and a free testosterone, that's why. And then, like I said, the sex hormone binding globulin. So for example, maybe someone has a high SHBG. That means that potentially there may be less circulating or testosterone for them to use. Estradiol, that's important to have because that's actually important for both men and women. So that can assess that estrogen balance, because remember we said testosterone and estrogen, if it's too high or too low, that can also affect your mood, your libido, your bone health. So we want to just kind of rule that out, make sure that's fine. DHEA, so that's a precursor to testosterone and estrogen. So it's made by your adrenal glands, and it can indicate just overall adrenal function and hormone reserve. So that's a nice one to get. Progesterone, that's a key hormone in the menstrual cycle, and it is also similar to the GABA neurotransmitter, which is in your brain, and that is what helps promote kind of that relaxation, that rest, relaxation. So that's a great one. Like if that one's really low, that one might help sleep better. So when your testosterone's off too, you can have sleep disruptions. So getting progesterone and estradiol checked, that's helping to kind of rule out other reasons that those symptoms could be happening. Like the mood and the lack of sleep and the irritability, etc. And and then we just want to really reiterate that yes, you're going to have these labs done, but just because maybe they're all normal and you're like, great, now I'm normal, but I'm not, like I don't feel normal. Rest assured, it should be symptom based as far as your treatment. Like just because your labs maybe don't show anything crazy high or low doesn't mean that you're not a candidate for therapy.
And like the best way like I can describe it, again, going back to men, just because that is the most common, whatever. It's like you said, you like that guy that comes in and he's at a 300. Okay, yeah, he's within normal, but if he's so used his whole life up until that point, he's been operating at a 900 or 1,000, he's gonna feel like absolute garbage at a 300, even though he's quote within normal limits. He's still not normal for him. Mm-hmm. And so, like, like we said, it's very, very important that you're finding a provider that you said, like, is listening to you and is treating your quality of life over the quantitative lab data. Because, again, you can be within normal limits and still not be normal for you.
Right.
And it definitely needs to be normal for you. That's why, like, everyone's dose, everyone's numbers, all that stuff is very different, because everyone is very different. Everyone's lifestyle is different. Everyone's body's different. Like, this isn't, it's not going to be like, and that's what's hard too, is I feel like, because it's not, hey, if you're at this number to this number, you get this dose, because it is very specific. So again, finding a provider or a clinic or whatever route you're going that treats you like that is super, super important, super key. So that you're actually getting quality, not cookie cutter, like, attention.
Well, and keep in mind too, some women, their happy place may be just over the quote normal limits, and that's okay. So, having a provider that's like, okay, are you having side effects? No. Do you feel good? Yes. Your level's this, and we could see that we had a rise from this. This is the dose. You're staying pretty stable. Life is all good. That's okay that you're just a little out of range on the high side. Yeah. Just like, we're saying it's okay to treat someone who is, still in normal range, but, the low end of normal range.
Yeah,
so
like their just life quality is not normal.
Right.
Yeah.
So this is, this was a good one. I'm trying to think if there's anything else. I know. So after you get testosterone, you've got to give it some time. So part of finding out, and finding out, like, is this going to be for me? Do I feel better? That's going to depend a lot on the route that you're using. So typically with pellets, you're going to see it be more effective sooner.
But again, you're going from like sea level to like Everest base camp.
Yes, and if you're one of those that you absorb it really quick, really fast, that may take you really high, really fast.
And that might not feel very good either.
Yes, that, we joke, but there's been men that are like, hey, can you calm my wife down? Like, this is too much.
She is 16-year-old boy, and look, it was fun for like the first 2 weeks, but I can't.
Yeah.
I am empty.
But, and like your creams, that's going to take longer. So I would say on average, you've got to give it about 4 to 6 weeks to really be able to gather. And that's probably not even going to be at your peak at that point. Typically, you'll have labs redrawn at the 3-month mark. Sometimes if you're really curious or if there's concern, maybe you were on another method and you switched, route, and you switched routes. Your provider might want to draw labs at like that 6 to 8 week mark just to kind of, gauge where you're at, see if you're going in the right direction. But typically plan to not feel a whole lot of difference for about that 4 to 6 week range. And then you should be getting follow-up labs usually about every 3 months. That can be very provider dependent. And, after you've been on testosterone for a long time, and you really get to feel your body, you can probably start to gauge about what level you're at just by how you feel. And so between your and provider, you might choose to space out labs even further.
Yeah.
So, but yeah, just going, if you feel like it's something you're interested in, just know that that's great. And there are tools out there for you, just like we said, we talked about Ozempic, and we'll get into a different podcast when we talk more about estrogen, progesterone, some of those, especially, in that perimenopausal time where women are often told, well, you're just, this is it.
Yeah.
This is just part of aging.
Don't give up on wanting to feel better, and don't let people make you feel crazy or embarrassed or ashamed because you're like, as a female, like, I think I need testosterone.
Yeah.
Something's
it's okay.
wrong. My foundation is on well.
And, we should be able to feel vibrant and strong
Yes.
and, empowered still at any age. And we live in a time now where we do have tools. We have to utilize them, but we have to utilize them safely. And that comes with being educated.
Yeah.
And so
I think
that's our own responsibility.
Yeah. And I think at the end of the day, all jokes aside, lady boners matter just as much.
I love that.
But so I guess I don't have anything else.
I don't either. I think we got it.
Yeah. So there's kind of like I said, a general nice intro and overview, and just kind of give you guys some stuff to think about. This definitely won't be the only time that we'll touch on hormones, especially testosterone. A lot of us have getting quite a bit of experience on it.
Yeah, but
we have
personal
stories. Yes. Personal stories as far as personal usage, friends, family, stuff like that has greatly benefited from it. I've got a couple friends that they're both on it, so male and female, and literally saved their marriage. Mm-hmm. So it's important.
That's something we advocate for also, is if you're going to treat one partner, look into the other partner, because if you're treating one partner but then the other partner is feeling just as crummy, you've only fixed half the equation.
Yes.
So really, encouraging couples, however that may look to you, to, let's get checked out together and see what we can do.
And go from there. And next episode, next week, I have no idea because our schedules are nuts.
We'll get it.
We definitely want to touch on a little bit more like some quote natural remedies or some other options too that you can maybe start diving into and seeing if that's going to help. If you are a little leery about maybe jumping straight to the medication side, when Nelson's here, she's got a little bit more experience in some stuff that she has tried and has had success with as well.
Because we won't touch on a whole lot right now, but there are some people that testosterone is not appropriate for them. So if they're still of childbearing age, you have to be careful, because you want to preserve the eggs. And same with the males, because the more testosterone you give, their body could potentially not make its own, and that can become an issue if
especially on the guy side.
Right.
Yeah.
So that hypogonadism. So anyway, all right. Well, if you guys have questions, if there's something we didn't, answer for you, or maybe it's something, maybe something you heard on social media, or you heard it on another podcast, and you're like, hey, but wait a minute, what about this? Let us know, because I always think that's interesting, and do our best to answer.
Yeah. Message, email, comment, all that stuff, and we'll do our best to kind of touch a little bit more on that. Or if you don't want the world to see your message, you can always direct message any of us or the page or anything like that.
Yeah, and we never say who sends the message anyway.
No, unless you want us to, then we totally can. That's fine. But so anyway, thank you guys, and like I said, next week we'll hopefully, knock on wood, maybe try not to make promises now at this point, hit part 2, dive a little bit more into it, and like I said, some of those more natural routes and other options for people to kind of look at and go for. So
awesome. Okay. Bye.
Okay, thanks. Bye.
And of course, we just want to always make sure to add that this podcast is for informational purposes only and isn't medical advice. So we shared with you our experiences and insights, but always check with your own healthcare provider before making any health decisions, and that is based on you as an individual.